Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the subject is statins and memory loss. So the reason I was sharing about this is because of a patient that I saw today who has indeed suffered from this very condition, which is significant memory loss that was caused by a statin medication. Now, statins are a group of drugs that are used to lower cholesterol with the purpose of lowering risk of heart disease and stroke. Now, these are widely accepted in the United States and in many places around the world, and largely are used for people who don't have a diagnosis of heart disease. They don't have a diagnosis of stroke. They simply have risk factors, and so the statin has been chosen as a way to lower their risk. The problem with this approach is that the number needed to treat for decreasing the risk for a single person is over 200 people just to avoid a non-fatal heart attack. You can look this up yourself by going to the NNT, or number needed to treat website. It has the statistics put in this common sense form of understanding what the statistics in medical studies really mean. So number needed to treat means how many people need to take this drug for 5 years to see a benefit. And for statins, to avoid one non-fatal heart attack, more than 200 men need to take this drug for more than 5 years. For a lot of patients, because of the downside, the side effects, it's not worth it to them to do that, but they rarely have this kind of statistical information when they make a decision. Now, the statistics are quite different. The number needed to treat are different for people that actually have a diagnosis of confirmed heart disease. It's closer to about 1 in 50 or 1 in 56 to avoid one fatal heart attack. In that risk factor avoiding heart disease, no firm diagnosis, that's not even a fatal heart attack that's being avoided. It's one non-fatal heart attack, more than 200 people taking the drug for 5 years. Well, this person that I was seeing today was one of those people. He just had been put on a statin drug years ago because his cholesterol was high. His doctor deemed that the risk was sufficient to start the medicine, and so he did. And as the years went by, he continued to take this medicine. And when I started to see him, I didn't tell him to stop the medicine. But in the last 6 months, I noticed that he was starting to have progressive memory loss. And he was looking exactly like somebody with Alzheimer's dementia looks. And he gradually got worse. His wife had to start coming to the office visits with him. And at that point, I mentioned to them both that it was possible that the statin drug was causing this problem. I said, there's no test that we can do to prove it. There's nothing you can do to reverse it if it is causing the problem, except to stop the drug. Well, they both were eager to test this theory, and so he did stop the drug. And within a month, you could start to see improvement in his memory. And now 3 months later, he is almost back to normal, but not quite. Now, there are a lot of people wandering around out there with memory loss and even looking like they might be becoming demented, who actually have it being caused by this drug, but nobody's thinking about it. And so I just wanted to bring this to your attention. If you're taking the drug and you've got confirmed coronary disease and other confirmed diseases that you're trying to prevent recurrence, that's one thing. But if you're taking the drug to prevent disease, that's a completely different thing. And if you're getting side effects that are severe, then in my experience, most of my patients want to stop the drug, even if it has a potential benefit, because they don't want those side effects. The side effects far outweigh the theoretical benefit for that drug. And remember that theoretical benefit is more than 200 guys needing to take the drug for 5 years to prevent one non-fatal heart attack. That's the actual statistics. So my encouragement to you is, if you're having some memory issues and you're on this drug, think about the possibility that it could be playing a role. It might be the major role. It might be the total cause, and you don't know without stopping it. So I'm not saying stop your drug. I'm saying talk it over with your doctor and see whether that would be a wise decision and how to proceed in doing so. So I'm not ever suggesting to move forward without sound medical advice, but sometimes people just don't think about it. And so I wanted to bring it to your attention. I wish you well, God bless, and have a great day.